You know, for decades, the UK's National Health Service was at the center of this huge experiment. The big idea was to see if you could make a public health system better by, well, turning it into a market. So today we're going to dive into this really fascinating and complex story and investigate a design that promised so much, but delivered something totally different.
And that's the central mystery, right? How could this massive, expensive, and long-running idea, which was supposed to fix the NHS, never really get off the ground? As we're going to find out, the answer isn't really about politics or people. It's about something much more fundamental: the design itself.
So the core idea, well, on the surface, it was actually pretty simple. The promise was that if you introduce a bit of competition inside the NHS, you could boost efficiency, improve patient care, and get more bang for your buck. Sounds pretty logical, doesn't it?
And this whole thing, they called it the internal market. The thinking went like this. You'd have different parts of the NHS, like groups of local doctors, acting as purchasers of care. And then you'd have hospitals acting as providers. They'd negotiate contracts, compete for business, and all those good market forces would, in theory, work their magic. But, and this is a big but, this is where the whole thing starts to unravel. The foundations were shaky from the get-go.
Okay, so let's dig into the first piece of evidence here. And honestly, it's probably the most important one. The whole concept of a market, any market, is built on one simple thing: choice. But what happens when the customers can't actually choose?
I mean, think about it. In a normal market, right? If you don't like the coffee at one cafe, you just walk across the street to the next one. Simple. But healthcare doesn't work like that. You're usually tied to where you live. Hospitals are built to serve specific areas. So you've got this system that's being told to act like a market while being physically structured in a way that makes it impossible.
And this really hits home when you think about it in real life. If you have a medical emergency, you're not exactly shopping around for the best A&E, are you? You go to the closest one. And those really specialized services for things like cancer treatment or maternity care, they're fixed in certain regions for very good reasons. Without any real choice, you can't have a real market. It's as simple as that.
And this is so important. This wasn't about NHS staff not trying hard enough. Not at all. The problem was baked into the blueprint right from the very beginning. The design itself was flawed.
All right, so that's flaw number one. Let's move on to the next piece of the puzzle because it all starts to connect. If you're going to have a market, you need buyers. But the way they decided to solve that problem, well, it created a whole new mess of its own.
So the plan was to turn your local GPs into the purchasers in this new market. What this meant was that billions, and I mean billions, of taxpayer pounds were basically handed over to these small private businesses, which is what GP practices are, so they could then go and buy hospital care for their patients.
And this, as the source material puts it, created a recipe for incoherence. I mean, you had all these private businesses, all wildly different in size and how well they were managed. They had no real economies of scale, and, this is crucial, there was no real way to hold them collectively accountable. If one practice messed up, it was just seen as a private business failing, not a failure of the wider NHS system.
So at the end of the day, it was just a complete mismatch. You're asking these small private organizations to do a massive strategic job for the public good. They just weren't built for that kind of role, and it caused huge problems from day one.
Okay, so let's recap. We've got a market with no real choice, and we have buyers who just aren't designed for the job. But what about the cost? This brings us to the next clue in our investigation: the huge and often hidden financial price of trying to force the NHS to act like a market. Just look at that number for a second. The Health Committee at the time estimated that all the bureaucracy needed to actually run this internal market pushed admin costs up to between 12 and 14% of all NHS spending. To put that in perspective, that's nearly double what it was before this whole market thing started.
So you've got to ask, where on earth did all that money go? Well, it went into building the machine of a market that didn't really work. We're talking about endless reorganizations, incredibly complex contract writing, brand new billing systems, huge consultancy fees, and layers upon layers of new oversight bodies. It added up to tens of billions of pounds that could have gone to frontline care.
And here's the real kicker. The problem wasn't a lack of reform. Oh no. If anything, it was the opposite. The NHS was suffering from way too much structural reform, constantly changing the org chart. And all that energy was stolen from what really mattered, actually improving how services work on the ground. Which brings us to the final piece of this whole puzzle. If the model was so broken and so expensive, why in the world did they stick with it for so long? Well, the answer isn't in economics, it's in politics.
I mean, it's the logical question, right?
Common sense says that if something clearly isn't working, you stop doing it. But in the case of the NHS Internal Market, the cycle just kept on spinning, over and over again.
Okay, so let's look at two different political systems. In many places, you have proportional systems where you need to build a consensus to get big things done. That tends to make things more stable. But the UK has a first-past-the-post system, winner takes all. This means a government can push through huge, radical changes without needing everyone to agree. And that creates a culture where every new government feels the need to come in and make a big splash with their own signature reform.
And what do you get from that? You get constant, disruptive churn. The political system itself actually rewards these dramatic, top-down reorganizations instead of the slow, difficult, but necessary work of long-term improvement. It's like tearing up the floorboards every few years instead of just fixing the leaky faucet.
All right, so we've looked at all the evidence. Let's pull it all together and deliver the verdict on the NHS internal market.
When you lay it all out, the conclusion is pretty clear. The whole model was undone by its own design, on two fronts. First, the whole economic idea of a market just didn't fit the physical reality of how the NHS actually works. And second, the political system itself actually encouraged this constant cycle of ripping everything up and starting again.
And this is the really important takeaway here. This wasn't a story about incompetent people or bad intentions. It was a design flaw right at the core, a fundamental mismatch between the idea and the real world it was being forced upon.
And so all of this leaves us with one massive lingering question. If this huge, decades-long project was pretty much doomed from the start, then what does work? What's the right way to think about improving healthcare? That's a huge question, and it's one we'll have to leave you with.